So over those years between the diagnosis and where I am now, I spent a lot of time in the gym experimenting, modifying all the exercises that I was doing. And the implementation of both spine hygiene and the core stability work went a long way in building up the resilience that I needed for my activities of daily living, for me to continue doing my weight training, which is the thing that I absolutely love. And also, I needed the resilience to have the ability to do my low back consults and my assessments, because they're very physical. Unlike many assessments where you just asked to bend forward and touch your toes and lean back, my assessments, we get quite involved in doing physical work to try and determine exactly what those pain triggers are. So I needed the resilience of my spine, not just so that I could do my physical activities, but I needed it so that I could continue with my career and earning a living. Everything was going extremely well. However, we always knew that there could be a little obstacle in the way, because what wasn't originally disclosed to me when I first got diagnosed is as to whether the spondylolisthesis was stable or unstable. Now, to not complicate things and get too involved, I'm going to make it really simple. But if you've got a spondylolisthesis, you need to understand if it's stable or unstable. So that bone that is fractured and slips forward over the other one, you need to know that if you move forward and if you move backwards and move your spine in different directions, does that slippage increase with certain movements? So the only way that you can get that assessed is through dynamic x-rays, where you need to bend all the way forward, they flex you forward, and then the radiologist gets you to extend back, and then they measure the differential if there is movement. Now, if that movement is greater than 3.5 millimeters, they classify that as an unstable spondylolisthesis. Now, when I took my original x-rays, they measured that the movement was sitting anywhere between 6 to 7 millimeters. So that very much was an unstable spondylolisthesis. And that comes with problems long term, unfortunately. But for a good 15, 16 years, I had absolutely no symptoms. I was extremely resilient. However, as recently as this last December, I started to get neural symptoms that I had never experienced before. And nothing had changed in my training. I'd kept the basics pretty much the same. I was diligent in my movement patterns. I was extremely calculated with regards to increasing load in the gym and doing more. So nothing had really changed. I hadn't sustained any major traumas over the last 15 or 16 years. And it was just the natural evolution of what was going to happen to my spine. I started to get these symptoms, and as we know, the world locked down early 2020 for the COVID pandemic. And during lockdown, I was still training and doing things at home, but unfortunately, the symptoms started to get worse. And there were many, many sleepless nights over those first weeks during lockdown, because I was coming to the point in my life where I needed to possibly consider spinal surgery. Now, the surgery of choice for a spondylolisthesis to reduce the fracture and stabilize that joint is the dreaded spinal fusion. Now, there's multiple different fusions, different options, different surgeons. Do we go with an orthopedic surgeon? Do we go with a neurosurgeon? Do we have a posterior fusion? Do we have a fusion where they cut you open in the front and insert the cage? There were so many questions that I needed to come to terms with if I was going to have the fusion. Those sleepless nights and the fact that I've worked with many spinal fusion patients allowed me to be a student of the game once again. And I read as many papers as I could, understanding the difference between neurosurgery and orthopedic surgery. And I got to understand all the different variations of spinal fusion surgery. Fusions from the front versus the side versus the back. What do they mean? Anyway, this gave me the confidence to ask the right questions. So I sat down with my surgeon, we had a long conversation, and at the end of that conversation, we decided that on the 15th of June 2020 was going to be my first step toward my L5-S1 spinal fusion.